Chronic hip pain is any pain that's been going on for longer than 3 to 6 months. And if this is the case, then the first thing we have to try and do is figure out what's the cause of that pain and try and get some form of diagnosis. And diagnosis is really broken down into two categories. We've got pain because of damage, and then we've got pain in the absence of damage. And so if there is any change in the structure of the hip, this would be a wear and tear, arthritic, tendinitis, bursitis, all these type diagnoses that many people come in and kind of have Googled and looked up. And the assumption is that if I've had pain for a long time, then arthritis and wear and tear has to be the cause, and it's a normal thing with aging. And this couldn't be further from the truth, because in fact, even with normal wear and tear and age-related change, this is not correlated directly with the experience of pain, because pain isn't only associated with the presence of damage. I can have a really arthritic hip and actually experience no pain at all. It's more about how the nervous system perceives all this different information that's going on, and whether or not it decides to make you aware of that by giving you the experience of pain. And so the first thing we need to do is assess that hip to see its range of motion. Is there severely limited rotation in the hip? Because this is the first immediate sign that, okay, the space within the joint is now becoming more and more reduced. At some point, it can be helpful to have an X-ray to look at simply how many millimeters of joint space are left, and the less that is, the more likely it is that a more severe arthritic picture is the cause. But actually this is less common, and we don't actually see this so often where we're having to refer patients out for surgery or other things. It's only in the more extreme cases where it's been left far too long. So the first thing is for us to assess it and actually figure out, you're probably not in that camp, but let's just make sure. And so what happens if, okay, maybe you do have some arthritic change, but it's not really anywhere near bad enough to be the cause of your pain? Well, then we need to start looking further afield. We need to look at areas of past injury in the low back, the knee, the hip, the ankle. Is that hip compensating for structures elsewhere? Because very often chronic pain is a solution, if you like, to a problem elsewhere. And so the place that you feel the pain is often not where the problem is. It's the area that's working really hard to actually try and help you out. When it comes to rehabilitating or getting over chronic pain, understanding movement is really important, and not just of the hip. And so what you'll be doing through the kind of stage 4 section is looking at, can you understand how the pelvis is meant to move in each direction, the low back meant to move in each direction, and the hip move in each direction? Because very often, if we're moving one way all the time and we don't get the opportunity to move the other way, some things can just get stuck. And so some of the tissues around the hip, the glute muscles and the piriformis and all these muscles that support that hip can simply get tight. Because the hip joint, just like the shoulder joint, is really mobile. It's what they call a ball and socket joint, so it has a huge amount of mobility. And so what that requires is muscular support to keep it stable. And there are a huge number of muscles that act upon the hip. And these need to work almost like an orchestra, all switching on and switching off at the right time for everything to work really efficiently. And so sometimes that can get a little bit muddled up. And so by trying to teach the body the correct way of moving again, we're trying to get some synchrony back through these muscle tissues. So what can you do to get over this chronic issue personally? Well, alongside the treatment process, one of the main things is actually understanding pain itself. And so we really encourage you to go through the pain education section to understand what pain is, why you experience it, because this will take a lot of the nervous system's fear of the unknown, fear of danger away as you start to understand what it is. And then we can start to do something about it. We can start to modify day-to-day life to not trigger the pain, and it becomes very much a management issue where we don't ever want to push into the boundaries of pain, but we want to keep moving. And so finding that fine line of how much can I do before it's too much? And it's not that too much is going to cause any damage, it's that it's going to trigger pain. And we don't want to be in a kind of pain loop. And so it might be that you need to take several breaks throughout the day where perhaps you're even just lying on the back for 2 to 3 minutes just to take the pressure off, take gravity away from these weight-bearing structures. So taking little breaks through the day, doing little gentle movement practices, 5 minutes, and you'll see the mobility section below that you can work through. It might be that some of those mobility exercises are too much or too hard, which is fine. Just take them out. Find 1 or 2 that suit you, that you can do, and just simply get moving that hip joint again. If the hip joint is too painful, start moving the low back. Jump to the low back section and do some movement work there. Because all movement is relative, and we're just trying to improve your body's awareness of that region. So little movement breaks throughout the day, little like movement snacks, modifying day-to-day life to prevent triggering of the pain. So we don't want to say, oh yeah, I'm going to just crack on and I'm going to push through the pain. Well, it's probably not the most ideal thing to do. We want to do a little bit of activity, stop, do a little bit more, and build it bit by bit. As I've already mentioned, alongside that, we're going to do some pain re-education and finally some strengthening. And so really, outside of having treatment, that's the main things that you can do. Movement, 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 and understanding. And really, that's what it comes down to. Any more symptom management through ice and heat and things like this, you can learn more about in the pain management section, but you have to be aware that these things aren't going to get to the root cause of the issue, although they may reduce the pain in the short term.